Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, Condom Guide answering the most common questions. When used correctly and consistently, condoms remain one of the most effective tools for the prevention of pregnancy and sexually transmitted infections, STIs. This includes external, male, condoms and the less commonly used internal, female, condoms. /r/n/r/n This article explains how condoms are used and their effectiveness. It also helps you choose the right condom to reduce the risk of pregnancy and STIs, including human immunodeficiency virus, HIV. /r/n/r/n Verywell Health acknowledges thatsex and genderare related concepts, but they are not the same. To accurately reflect our sources, this article uses terms like male, female, man, and woman as the sources use them. /r/n/r/n Illustration by Zoe Hansen for Verywell Health/r/n/r/n For many years, the word condom was used exclusively to describe an external condom, also known as the male condom. This is the type of condom applied over the penis to prevent the release of semen into a receptive, bottom, partner. /r/n/r/n Though external condoms remain the predominant form of barrier protection, some couples opt to use an internal condom, sometimes referred to as the female condom. This condom is inserted into the vagina or anus to prevent exposure to semen from the insertive, top, partner. /r/n/r/n Both external and internal condoms can significantly reduce the risk of unintended pregnancy. They also have varying degrees of effectiveness in preventing different STIs, including HIV. /r/n/r/n Short of abstinence, no method of birth control is 100% perfect. However, when used correctly and consistently, condoms come pretty close. /r/n/r/n The risk of pregnancy varies by whether you use condoms consistently and correctly every time you have sex, referred to as perfect use, or have occasional lapses or errors in use, referred to as typical use. /r/n/r/n The risk of unintended pregnancy also varies based on whether you use external or internal condoms, as shown in the following table. /r/n/r/n What this means is that, with perfect use, 2 out of every 100 couples who use external condoms for contraception will become pregnant within 1 year. With typical use, the number increases to 13 out of every 100 couples. /r/n/r/n By contrast, with perfect use, 5 out of every 100 couples who use internal condoms for contraception will become pregnant within a year. With typical use, the number increases to nearly 1 in 5 couples. The disparity is due in part to the fact that internal condoms are more complicated to use than external condoms, making them more prone to user error. /r/n/r/n To better minimize the risk of pregnancy, some individuals opt to use a secondary form of contraception, such as vaginal spermicides, which have an efficacy rate of between 72% and 82%. /r/n/r/n The effectiveness of condoms in preventing STIs varies by the disease type. Condoms tend to be more effective with STIs that are mainly passed through body fluids like semen and less effective with those that are readily passed through skin-to-skin contact. /r/n/r/n The latter includes STIs like genital herpes, human papillomavirus, HPV, and syphilis, which can be transmitted through skin contact. The person may be asymptomatic and have no idea they are infected. /r/n/r/n Condom efficacy rates range from high to negligible, as follows. /r/n/r/n The low rate of efficacy with genital herpes and HPV accounts in part for why the diseases are so widespread in the United States. According to the National Center for Health Statistics, 1 in 9 people ages 14 to 49 have genital herpes, while 4 of every 10 adults have HPV. /r/n/r/n Choosing the right condom can seem overwhelming, given that they come in many different brands, shapes, colors, types, and sizes. However, with a little education and insight, you can choose the one that best meets your needs and preferences. /r/n/r/n One of the first things to consider when buying a condom is the material it is made of, which can include latex, lambskin, polyurethane, polyisoprene, or nitrile. /r/n/r/n Each material has its pros and cons, as follows. /r/n/r/n A common complaint about condoms is that they reduce sensitivity. However, the problem may not be the condom itself but rather the fit of the condom. /r/n/r/n If an external condom is too tight, it can cause pain and increase the risk of bursting. If it is too loose, it may slip off or reduce sensitivity by bunching up. A condom that is too tight can also lead to problems like delayed ejaculation. /r/n/r/n Fortunately, external condoms come in many sizes, usually with a size chart describing the range of sizes suitable for that condom in inches or millimeters. /r/n/r/n To find the condom size that's right for you, you need to measure the length and girth, circumference, of your penis while erect. You can do this with a flexible measuring tape as follows. /r/n/r/n Of the two measurements, girth is arguably the most important as it influences how comfortably and snugly the condom fits without the risk of bursting or slipping off. /r/n/r/n Standards vary, but most US manufacturers categorize condoms as being small/snug, regular/standard, large, and extra large. /r/n/r/n Internal condoms come in one size only. The condom, marketed in the United States under the brand name FC2, is roughly 6.5 inches long and with a circumference of 3.55 inches. /r/n/r/n The lack of sizing is one of the reasons why acceptance of the FC2 has been lower and why some women describe pain and discomfort when using them. /r/n/r/n Condom size is only one of the factors that can influence sexual sensitivity, another is the condom material. In addition to allergies and lubricant restrictions, comfort may be one of the factors that affect your choice of condoms. /r/n/r/n By comparison, /r/n/r/ny The reduced sensitivity is one of the more common complaints associated with condoms. A study from Indiana University recently challenged those beliefs. /r/n/r/n Based on a survey of 1,645 adults ages 18 to 59, the researchers could find no significant difference in sexual arousal, ease of erection, orgasm, or overall pleasure between participants who used condoms and those who did not. /r/n/r/n Condoms come in many textures, colors, flavors, and scents, which may be sexually stimulating for some people but not for others. /r/n/r/n The response to these novelty condoms is highly individual. While ribbed condoms may be pleasurable for some, they can irritate others who have sensitive genitals. /r/n/r/n Similarly, flavored and scented condoms may hide the taste and smell of latex but may also contain chemicals that irritate the genitals, causing pain and redness. Some might even trigger an allergy or contact dermatitis. /r/n/r/n Moreover, sweeteners like glucose or glycerin, commonly used in flavored condoms, can trigger the overgrowth of yeast, leading to a yeast infection. /r/n/r/n Even lubricated condoms containing nonoxynol 9 can be irritating. While the spermicidal agent may provide added protection against pregnancy, it can also cause vaginal lesions if overused. This, in turn, can increase a woman's risk of getting HIV or passing it to a partner. /r/n/r/n Cost is another factor people commonly consider when buying condoms. /r/n/r/n As a general rule, lambskin condoms are the most expensive option, retailing at around $20 or more for a box of 3. At the opposite end of the scale, latex condoms can be found online or through big box retailers for as little as $3 for 3. Polyisoprene and polyurethane fall somewhere in the middle, with polyurethane being slightly more expensive. /r/n/r/n What's important to remember when buying condoms is that expensive doesn't necessarily mean better. Whether costly or not, all condoms sold in the United States including novelty condoms must adhere to standards issued by the Food and Drug Administration, FDA, as so-called Class II medical devices. /r/n/r/n To meet FDA standards, all condoms sold must have at least a 99.6% rating. This means that 996 out of 1,000 condoms, on average, must pass the test. /r/n/r/n Despite the cost barriers, there are ways to find free condoms from governmental and non-governmental health organizations in your area, such as /r/n/r/n To assist with your search, the Centers for Disease Control and Prevention's CDC's National Prevention Information Center offers a free online tool to locate organizations near you that provide condoms for free or at low cost. Some may even send you free condoms by mail and even lubricant and other sexual health products. /r/n/r/n If paying out of pocket, FC2 condoms can be costly, retailing for as high as $200 for a box of 12. With that said, internal condoms may be fully covered by insurance under the Affordable Care Act, ACA, if they are prescribed by a physician or a qualified healthcare provider. /r/n/r/n You may also be able to find free or low-cost internal condoms from organizations like Planned Parenthood, family health clinics, and women's health centers. /r/n/r/n Once you have chosen the right condoms, the next step is to learn how to use them properly. As with anything, practice makes perfect once you learn the basics. /r/n/r/n Steps to put on an external condom include /r/n/r/n Steps to put on an internal condom include /r/n/r/n As straightforward as condom instructions may seem, there are a number of mistakes people commonly make when using them. /r/n/r/n The do's and don'ts include /r/n/r/n With proper storage, external condoms have a shelf life of 3 to 5 years, while internal condoms have a shelf life of 5 years. /r/n/r/n As important as condoms are to your sexual health, some people dislike them and need alternatives that can offer ample protection against pregnancy or STIs. /r/n/r/n To prevent pregnancy, there is a large number of reversible and permanent solutions to consider, including /r/n/r/n Alternative tools for STI prevention are few. While safer sex generally infers the use of condoms, there are other things you can do to significantly reduce your risk of infection, including /r/n/r/n When used as prescribed, PrEP is even more effective in preventing HIV than condoms. This doesn't mean that you should abandon condoms if you start taking PrEP. /r/n/r/n It is important to remember that PrEP does not prevent STIs like chlamydia, gonorrhea, or syphilis. Getting these infections can undermine PrEP by compromising tissues and the body's immune defense, increasing the risk of HIV by as much as threefold. /r/n/r/n Condoms are an essential tool for the prevention of pregnancy or sexually transmitted infections. These include external condoms that cover a penis and internal condoms that are inserted into the vagina or anus. /r/n/r/n Most condoms are made from latex, while others are made from lambskin, polyurethane, polyisoprene, or nitrile. Each has its benefits and drawbacks. While all condoms can protect against unintended pregnancy, lambskin condoms are ineffective against STIs. /r/n/r/n. Other strategies may help reduce the risk of STI, including a reduction in the number of sex partners, HPV and hepatitis B vaccination, and pre-exposure prophylaxis, PrEP, to prevent HIV. /r/n/r/n/r/n/r/n. Thank you. Form.email, for signing up. /r/n/r/n. There was an error. Please try again. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.